What's up, everyone? Welcome to the Tired Mums podcast. Woo! This is our spin-off, Third Wheelin. We're third wheelin'.
And I'm actually the third wheel today because we have two guests and one me, and Bree's here, but then
I'm going. Goodbye.
Bree's going to step out and it's just be myself and our amazing, beautiful guests inside and out, I have to say. We are privileged to have the most beautiful OSTEO'S you've ever seen with us.
I feel so good about myself.
What an intro. I've got Dr Kim Myer with us. Is that okay if we say your last name?
Yeah, you can.
Okay,
I'm now exposed.
Even though you have a presence on the internet already, I was like, oh God, because, you know, just in case. And beautiful Dr Zara Phillips with us. And did I get that right?
Yeah.
Excellent.
The intros have gone well.
Guys, I'm nailing it by myself. This is weird by myself. And I'm also sitting in like a different seat, so I'm a bit razzed. But
I've got your role.
yeah, you do. That's right. Kim, you are a osteo.
Yep.
Specialising in running.
Yeah, correct.
Zara, you are an osteo.
Yes.
Specialising in the pelvic floor.
Yes. Yeah.
And also you're a registered nurse.
Yeah.
Yeah.
I've studied for a very long time.
You have. My gosh. Are you?
Don't recommend the hex I've got. Do
Oh, I feel you. Are you done with studying, do you think? Or
you know what? I reckon there'll be a women's health masters in there at some stage.
She's addicted.
I think you,
I like learning.
yeah, I feel like it's so like I feel like you should. I don't want to, you know, like to tell you to get more hex, but you are. And I will say, like, I've had a consultation with Zara, and I already told Kim this. That's like it was so amazing. It was so amazing, honestly. And I was laughing in the car on the way home to myself because I was like, considering I just had an internal exam, it was phenomenal. Like the consultation was phenomenal. Like it could have been horrific, right? And I just walked out of there. I was like, I have learnt so much. Like, and on a topic. So everybody, we're going to talk today about the pelvic floor, and on a topic I think that is like. We kind of know some symptoms as women in general, you know, what to look out for. But I think the whole kind of topic is it's overlooked a bit, and it's not discussed enough in the sense where there's like so many different symptoms you can have and so many different like aspects of it that can affect like your overall musculoskeletal health. And I think women just don't really... Yeah, we just don't really know about it. Like I was talking to Bree about it, and she's just like, I have no idea what you're talking about. You know, like it's just, and especially after babies as well. It's like, go and get your pelvic floor checked, and your GP sort of like asks you some questions, and that's it. So people probably don't even know that osteos do this sort of stuff.
No,
Yeah, correct.
I feel like the osteos have probably been in the space for a while, but now it's probably more recognised, which is pretty cool.
Yeah. Very cool.
Yeah.
Very cool. So first of all, and also running as well, which I didn't even know. You told me about that, like being a running osteo, that your pelvic floor can, you know, as a running expert, that pelvic floor can also play a major role in that, which we'll talk about as well.
Yeah, definitely.
Yeah.
And I think a lot of like, it's not necessarily just if you've had kids as well.
Yes.
There's a lot of young females with overactive pelvic floors that present with like back pain, hip pain.
Yep.
And it's all actually related back to your pelvic floor. Like it's multifactorial, but if the pelvic floor isn't actually addressed, then people don't tend to get a resolution of their injuries.
Which is wild because like how many women have back pain, you know? Like,
So many.
Yeah, so many. As you would know, every day you see them, which you wouldn't think. Like it's,
Definitely.
but even men too, I'm sure, right? Like,
yeah, for sure.
Yeah.
And I think it's tricky with men as well because they have even a less understanding of pelvic floor.
Yes.
So when I even try and bring up pelvic floor and ask them about symptoms, I think they're even more guarded about the topic than women.
Yeah.
And I guess maybe because I'm a female practitioner as well. But sometimes it's one of those things that you have to address. And when you do the digging, you find out that, okay, well, they do obviously have symptoms of pelvic floor dysfunction, and trying to educate them on like things that they can do to help that and what it is really important for them as well.
Yeah, and that's amazing because also like running, like so many people are running now, you know, like it's just
very cool now.
It's so cool. It's just like, exploded. And, you know, we've spoken about before that I am not one of those people. My husband, like you guys.
I see your husband actually for running stuff.
Exactly. Yeah. I mean, you pretty much treat my whole family, but like they, like men, you know, like, oh, I'm off on my long run or whatever. But it's like, it's so interesting because as you're saying, that conversation is pretty important to have, and long-term effects and all that kind of stuff that they probably wouldn't even think about. But why would they? Because it's not.
It's
like
not
you
spoken about.
Yeah.
So how would they have that? And I guess like we actually affiliate pelvic floors with women and pregnancy and postpartum. So men are sometimes like, do I have a pelvic floor?
Oh, there you go.
Which is valid because like it's not spoken about. So of course you would question if you have that thing.
Yeah, like
Absolutely. Yeah. Well, I was going to ask you, like, let's break it down because again, this is the thing I probably don't think many women or men would be able to answer. Like, what is the pelvic floor?
So I guess, great question.
Yeah, right? Because like you hear about it, it's just like, yeah, but what does it do? What is it? Like it's because
we talk about it and you kind of like have an idea maybe of where it might be. But
Yeah.
then, you're right. You kind of just also like, but I think it's that, but I actually don't really know.
Yeah.
Yeah. So very common that question.
Yeah.
So essentially with the pelvic floor, it's like a hammock, right? So it's full of connective tissue, ligaments and muscles. And essentially it helps to hold up and support our uterus. So we're talking for women here.
Yeah.
Our uterus, our bowel and our bladder.
Yeah.
It also plays a role in supporting through the pelvis as well. When we kind of talk about the function of the pelvic floor, so it allows us to hold on to wee, it prevents us from farting all the time, and it also allows us to relax so we can have a bowel action, as well as plays a role with arousal and intimacy. The pelvic floor is also heavily connected to the core. So often when we have dysfunction in either like our breathing or our deep core, we actually see that there's also dysfunction through pelvic floor because they work in unison, and I can go into that in a bit of detail later.
Yeah, wow, that's very interesting as well. That's like another association that many people wouldn't think of either, right?
No, you kind of just think it's like down here, separate to everything else, you know, but it's actually like the more I learn about the pelvic floor, the more I'm like, oh my God, it's literally connected to everything.
Yeah.
You know, when people present with back pain and things, it's like, well, often they do have pelvic floor impact as well, just because of how closely things are linked. Yeah.
And like I imagine being stressed and having stress would also impact the pelvic floor as well. Like I'm just thinking of, you know, being a mum of multiple kids or having like a high powered job or something and you're really stressed, you probably wouldn't automatically think your pelvic floor is impacted in that.
But no, it definitely is, exactly. So the pelvic floor is innervated by our what we call autonomic nervous system. So if we think like, and a lot of people have probably heard things like rest and digest system and then more of that fight flight system. So because there is that innervation to the pelvic floor, it actually means that when life is stressful, when there's so much going on, the pelvic floor inadvertently is going to be impacted for most people. And often that's where, you know, people will have these kind of silent symptoms and think that that's just normal. Yeah. But really that's actually a component of increased heightened nervous system as well.
Yeah, right. Yeah. And what are some of the, like, I guess, what are some of the really obvious symptoms that, you know, we probably more commonly hear about?
Yeah.
And then what are some of the symptoms that we wouldn't think would be associated?
Yeah, so I feel like hidden symptoms might be more associated with kind of what Kim was saying, like, say when we're younger, we haven't had kids, like, not saying everyone's going to have kids, but, you know, we haven't had kids yet. And it might be things like we get a bit of discomfort with intimacy. So be that like on insertion or deep penetration, maybe not all the time, but sometimes.
Yep.
We might find that like key in the door triggers us to need to run to the toilet.
Yep.
We might find that we actually need to wee a lot. But when we're weeing, we're actually not passing that much wee. And then people might even just find that they're getting pain. So it's like if they sit for too long, they're like, oh, my coccyx really hurts, or I just feel really sore like around my like butt or hip. Or they might get things like deep hip pain that, you know, they think it's maybe labral or low back, but actually it could be a pelvic floor component. Or things like running. Maybe they go for a long run and when they do, you know, they're fine when they do maybe they're like 5 to 7K. And then when they do their 16, by the end of that run, they're getting some leakage. And often that's the stuff that like not really talking about. And then say when we think about postpartum, and this is probably where a lot of people kind of start to present to say like seeing a pelvic health practitioner is like due to the demands of like carrying a bubs for 9 months and whether they had a vaginal delivery or a cesarean, that dysfunction through pelvic floor becomes very prevalent now. So maybe now they're getting pain all the time through hips, low back. Maybe now they're actually leaking when they cough, sneeze, jump.
Yeah.
Maybe now they actually like key in the door. They can't make it to the toilet. They're getting leakage.
Yeah, okay.
Or they're getting symptoms of things like heaviness, drag, a sensation of the golf ball at the vagina. So things like prolapse symptoms as well. So yeah, I guess a lot of the time, well, not always. Obviously, it's very dependent on like we know with birth trauma. So if there's extended active pushing time or the use of forceps or vacuum, that is going to heighten pelvic floor dysfunction or trauma and issues. But often it's like for a lot of women, these symptoms may be prevalent, but it's just heightened when we kind of go either in that postpartum period or even when we think about hormone shifts during perimenopause and menopause. We actually may kind of get away with like, you know, still being okay in that postpartum period, and then we present to peri and menopause, and that shift in estrogen means that the tissues are so much stiffer than they were, and so then we actually start to get these symptoms. So maybe you had a little bit postpartum and then it kind of settled, you know, didn't see anyone about it and just kind of carried on, which is probably most women because, you know, that's what we're kind of told to just keep going.
Yeah.
And then you see. Yeah, literally. Exactly. And then we kind of get that shift in hormone and now we're getting the symptom of prolapse. We're getting that heaviness. We're feeling the golf ball at the vagina. We're actually getting leakage when we jump, cough, key in the door and like we can't make it to the toilet. So yeah, it's interesting how it presents so different for different people.
Yeah. That like the things that we go through as women is just, you know, you saying all that is just like wild because you're right. You think, oh, I've made it through birth. Yay. Like my pelvic floor is fine. But no. Like it can hit you later on.
And I think a lot of people also normalize the symptoms. Like I
Yeah.
think people make jokes and everything about like, oh, can't jump on a trampoline. Oh, I just peed myself when I laugh. And it's like you kind of put like humor and like normalizing
Yes.
it, but really it's telling you that there's an issue that needs to be addressed. But yeah, it's just normalized.
Yeah, that's so true, isn't it? Like the jumping on the trampoline, that's what I think of straight away. And it's like, haha, like I weed myself. It's like, oh, it's like, no. Yes, okay, good that you can laugh about it, but also, you know.
And look, there's probably the other end of the spectrum as well where people do feel shame around it. Like people feel that embarrassment around like needing to go to the toilet a lot or leakage. And like I know when I ask some of my clients questions like, oh, do you have any leakage? You can see it straight away.
Yeah.
They like pull back and they're like, oh, yeah, like just like a tiny bit.
Oh.
And then like you have to kind of make them feel comfortable and drag the information out of them and like understanding that like it's not normal, but it's okay that you have those symptoms as well.
Normalizing it.
Well, I did want to say thank you for being like such amazing women in our community. Obviously, we're in Melbourne and Kim, your practice is in Melbourne, but you are online as well. But it's like, sorry, you do have an online presence, but it is actually amazing to have women practitioners in this space because it's so important. And like when I was with you, Zara, I was so comfortable, and obviously I've been treated by you, Kim, many times, like so comfortable. And it's just like so important, you know, to have practitioners like that where you just kind of can go to and say, look, I'm having an issue. So thank you, ladies, because, you know.
Just trying to spread the conversation.
You are. But even, you know, doing this and being happy to have this conversation, like it is so important. And have no doubt that like after today, people will be like, oh, maybe I should go and like, you know, get my back pain actually looked at for one, but see what's happening with my pelvic floor. Even so, I was like amazed, Zara, how we spoke about C-section scars and like, you know, the adhesions or like scar tissue, that kind of thing, and how that can impact the pelvic floor too, because like I did have some understanding of it, but not to that extent, like that can actually, that can play a role. Like it's so many like multi sort of faceted sort of, parts of it.
Yeah, it's quite interesting with the cesarean scars. So because they cut through 7 layers, which is pretty substantial, we're thinking muscle, fascia, tissue, skin. What often happens with that is it means like our deep core and our core can't function as effectively. So then the pelvic floor is going to be working overtime to provide extra support and stability through the pelvis when we're just functioning day to day. And then the same, like if we kind of, when we think about scars, exactly, they do have like adhesions around the area. And so sometimes when there is like increased tension and like scar tissue around the cesarean scar, it actually can be linked to things like increased urinary urgency or pelvic pain, even like pubic symphysis pain. So it's quite interesting how like just doing some self-release work, talking about breath, engaging through core effectively, that can make such a difference for post-cesarean scar, just overall function.
Yeah, wow. Because I can tell you, and I'm sure you've been told before, when you get a C-section, that is not a conversation. Like there is nothing in terms of rehab with a C-section where it's like, 6 weeks, cool, or whatever, I don't know, a couple of months, you're fine, off you go. But when I had my second baby, it was like she was in a carrier and I was off with my first to the park. You know what I mean?
Yes,
and I just
so
had a major surgery.
And they're like, do not lift anything heavier than your baby. You're like, my toddler is already heavier than my baby.
Yeah.
My pram is heavier than my baby.
And
my washing basket's heavier than my, so it's just not as straightforward as like the advice that we're given, unfortunately.
Yeah. And it's not like a detriment to anybody. It's just like people can't be experts in everything. It's just, when you're in it, you're like, that is stupid. That is stupid advice. But
it's maybe with your first, that might be so achievable. But when you're right, imagine you've got like 3 little ones running around and they're saying, don't lift anything heavier than your newborn. You're like, I literally can't not.
Or like sit and rest. Sit and rest. What's that? Like that's not happening. But
I have children from all sides. I can't sit and rest.
Yeah, God no. But is there like for us, you spoke about perimenopause before, and like tissues changing and that kind of thing. Is there an exercise? I guess like this is a big question, but is there an exercise like if you were a time poor mum and you were like, I am going to pick a specific exercise to do for my overall health and my pelvic floor health, and is there something that you get big bang for your buck to do? Like, so Kim is obviously, you love running, right? Like that's your jam. So would you recommend running or like weight training, or what would you think is kind of like the best form of exercise to do for women in general, postpartum, pelvic floor considerations, all this sort of jam?
Yeah, of course. So I would say it's all about like staggering it and like getting the right assessment at the start to understand where your body's at. So having the information to know where is my body at? Can I start running? Have I been cleared by a practitioner?
Yep.
And like, where is my strength at? So say as a really general thing, a good like return to exercise thing would be like just some body weight resistance work to start with.
Yep.
And I like to stack my exercises. So if my go-to exercise to start with someone would be a glute bridge, but you're stacking the deep core and the pelvic floor in it. So do you want me to describe how I would do that?
Go for it, yeah.
Get your bridge on, ladies.
Can already feel my glutes, sore from this.
All right, so if you're laying on your back with your knees bent up, so your feet are on the ground, your back's on the ground. So I would be thinking about stacking it. So we'll start with what we're thinking about with our core. So if I push my back onto the ground, that's automatically going to take that curve out of my spine and it's going to help engage the pelvic floor. So if I'm putting my hands on my tummy and I'm thinking, hands are on my hip bones, fingers are on my ribs, and I'm thinking about hips to ribs. So it's that flattening of the back onto the ground with the hips to the ribs. That's going to automatically help my deep core activate. We know the relation between the deep core and the pelvic floor. When that core is activating, it's going to also help with the pelvic floor. So once they've got that core cue like working, then I would say like try and tense up through your pelvic floor as well. So you might be thinking about the cue of like you're holding in some urine. So then you've got your core, you've got your pelvic floor engaged. And then you're going to lift your hips up towards the ceiling and squeezing through your glutes. And so then you're getting your glutes and your hamstrings involved as well. So you've stacked this exercise. So you're getting all these areas moving that are really important to getting your body back to all the things that you want to do.
Yeah, cool. Well, I think that just like sums up why you should see somebody who knows what they're talking about. Because you know when you see things online and people are like, oh, you're good to go after like 6 weeks, like off you go for a run. You know, that sort of the stuff where it's like you're probably doing more harm than good by just heading out.
Yeah. It's so individual from case to case. Like some people from 6 weeks, I'm like, here's your return to running program. And other people, it takes like 6, 9, 12 months to get them back there. So it's just really important to know.
There you go. And we should talk about your clinic.
Oh, yes.
Yes, let's do that.
Back to us.
Which I have to say, and I'm sure Zara would agree, is the most beautiful clinic like
It's stunning.
ever.
Thank you.
The aesthetic of it, it's like
I went for bougie wellness vibe.
Well, you nailed it. Because like you walk in and you're just
day spa.
Yeah, and working there must be lovely, and it's just like
so nice.
full sun, and it's just like it's beautiful. But so Myomassage Osteo. So give Kim a follow as well on Instagram, and you're on TikTok too. But we're saying we
don't understand TikTok yet,
no.
so I'll see you on Instagram.
Yeah. Give us a follow on TikTok if that's your jam. It's not ours, but yeah. And you do a lot of info on Instagram as well, right? So a lot of like assessment sort of stuff and exercise sort of little tidbits too, which is also awesome to look at. And you offer Pilates as well. So
Yeah, we do.
I imagine Pilates is a big part of your rehab program when women come in and post-birth.
Definitely. So, we have basically a program called Clinical Exercise, which incorporates clinical Pilates, which is reformer and mat-based. And then we also have weight machines. So we have a leg press, we have a hack squat, we have a cable machine, because Pilates is a great start, but combining that with some heavy resistance training when the person is ready gives you some really great results.
Yeah, very cool. Have you listened to that podcast episode with Mel Robbins about weight training? About
Stacey Sims.
Have you listened to
Dr.
it?
Stacey Sims, yes.
So
Bit of a fangirl. I went to see her live. She's unreal.
Oh, cool!
Yeah,
Wow! When did she come to Australia? Did she?
Yeah, with the oh my gosh. Anyway, with a different podcast. I fully gone blank.
Oh no, don't worry.
My brain was like absolute brain fart.
That's me every day. Yeah. So I haven't actually listened to the whole thing, but just like shorts, because it's some people don't have time. But yeah, and how she was saying like during perimenopause, like lift weights, and as we know, like to prevent osteoporosis and all this stuff, it's like the best thing you can do. But she was saying, what did she say? Like short bursts of heavy weights, right?
Yeah. And then the same, like she does like a little bit of high intensity stuff too.
Okay.
So, but the high intensity, it might literally look like 30 seconds on a spin bike, running literally like to end of the street and then walk back. So because I know that there's a bit of like mixed information around like HIIT training, but she kind of says it in the sense of like, we want to increase your heart rate because you need that cardiovascular protection.
Yep.
But it doesn't necessarily mean like go and do an hour HIIT session. It's just like short bursts of increasing heart rate will provide enough to protect the heart.
That's pretty cool, and it's nice because like
to achieve it as well, right?
So achievable, and also like you go to some of these classes and they're like, do 50 push-ups, and then you just hurt yourself.
Exactly.
And,
you can't go back.
Yeah.
You're like, one and done, thanks.
And that's your association where it's like, those classes aren't for me, I'm not, but like walking into this kind of space with like women who are qualified that can like write you a full program is ideal.
Definitely.
Yeah.
And it's like, even if you only do it for like 6 weeks, then you have the information, because when you're doing a clinical class, it's all about educating people of this is what an ideal week for your exercise would look like.
Yeah.
So then they have that information for life. So they can then go and do a home program if that's more easy for them.
Yeah.
But it's like having that education just helps guide you for the rest of your life.
Yeah. And give you confidence.
Yeah.
So like you can transfer that to any like space, right? Like walk into a gym and be happy to do a leg press and not like
just
freak
stay
out
on the cardio machine.
Yeah.
And I think that's it. Confidence in exercise is probably the biggest factor, right? Is a lot of the time the deterrent with like gym or classes is like the unknown of haven't done it before, don't really know how to do it, don't want to injure myself. So exactly, this provides a space where people have confidence in their bodies with exercise.
Yeah, and like lifting weights is actually like the best, and it's really fun, but also it's like it is actually really good for you. It's not just for men to go and like squat heavy.
Yeah.
I think
Build their
the
muscles.
transformation in people when they've gone from like in our classes, we've had a lot of people who haven't exercised since kids. And then they come in like 6-7 years later and you see them get strong and there's like this confidence and transformation that you see in them. Like the person that they walked in when they hadn't done any exercise to now that they're strong, they're confident is like pretty amazing.
Yeah. And each time, like,
very
it's
cool.
so cool how they're like, I can do this. Like, that contrast of like, oh yeah, when I started, I could only do like 4 glute bridges and now they're doing a hack squat, with load. So it's so cool when they recognize like the change that they've made.
Absolutely. And to do something for yourself because, I'm sure like, as you know, when you have kids, like that is yourself is last. So then, take control of your health. Like Brie and I have just joined a gym last week and like
Congratulations.
Yeah, thank you. Like the first step. And it's like we bring the kids though, so it's actually not like that great. But we walk in and, and I'm like, oh, like here we go. Like I'm off again. Like pre-kids, I love the gym. And I'm like, this is the journey. Like we're starting. But mind you, it's like having to also entertain the children
At the same time.
time. So it's not actually like during the week, it's, you can only do what you can only do.
Exactly. And maybe they just do the exercises with you. Sometimes that's the thing. It's like if you can only do things at home, why not like grab a washing basket or something heavy and then do some squats with your little ones or get on the floor. Exactly. Do some bridges, but do it with them. Often like depends how, like if they're a baby, it's a bit of a different story, but you might use your bubs as the weight.
Yes.
So it's like thinking if you can't get access to a gym, you can do it at home. It's just like finding ways of creating that space at home.
That's very true. Is there any, do you guys know of any online programs that you would recommend? Because people are like, oh, jump on YouTube and like, is there anything that springs to mind where you're like, this is actually like a safe sort of, or is it more sort of what you were saying? It depends on everybody's levels postpartum and
So I would say like if you wanted to do it that way to make sure it was safe, you'd have that like consult with a practitioner first to understand where you're at.
Yeah.
And then the practitioner could probably recommend like a program that you could use, but then just having that knowledge of what your body's capable with.
Yeah.
You could use so many different YouTube like apps, whatever, but you just kind of have to know where you're at.
Yes. Yeah, that's a good point. I remember like at times just jumping onto some app and doing some workout and then afterwards being like, I actually can't walk. Like that was probably too much. Yeah.
I went too hard.
Yeah. Like, because you just don't know your level of fitness.
Where you're at.
Yeah. So that's, probably good advice not to just.
I do, sorry to interrupt, but the Mama Physio, she has some awesome stuff.
Oh,
Do
yes.
you follow her?
I do. Yeah.
She has very like nice, clear, we're thinking postpartum obviously.
Yep.
So like nice, clear kind of like, this is what I do, say at 6 weeks, at 12 weeks. And I kind of like, because obviously she's a physio, she's very clinical based and she does Pilates and stuff too. So I often point women in that direction in the initial phase if like sometimes they don't have capacity to say like come and be assessed, that kind of thing. Yeah. But she has some good stuff.
Yeah, good one. I do follow her. You're right. She is good.
Yeah.
And is there anything like postpartum, talking about the pelvic floor again, in terms of like when you have a little baby or even as like your babies grow, is there anything you can be doing to protect your pelvic floor? Like I know from my experience, there was a lot of rocking involved with my baby. There was a lot of pushing the pram. There was a lot of, lifting and some stuff like you have to do it. Like there's no way you can get around it, but there is a way that we can kind of protect our pelvic floor for those sort of activities.
Yeah, definitely. So with rocking, often better in like seated position if possible. So propping bubs up just so we're not kind of feeling like we're slumped forward.
Yeah.
So if we can get a really nice upright like posture, if we stack ribs on top of pelvis, that actually allows for effective movement of the diaphragm, which will protect the pelvic floor. So if we like slump back or we sit super forward, we actually can create a little bit of dysfunction through movement of diaphragm and then that connection to pelvic floor. And so then sometimes we can increase symptoms of dysfunction that way. So I'd say if we're rocking, prop bubs up so you're not going to hurt back and shoulders, and then try and feel like you are in more of a stacked position, even if that means like place pillows behind your back so you can get, because I know you fatigue, you get so tired, you probably slept so many hours, so even if there's something that kind of helps you support sitting in that position. When we think about lifting, so say even if we're getting bubs up off the floor, I often recommend like try and get into that lunge position. Then what we're trying to do, so with the pelvic floor, I might just explain a little bit with like connection to the diaphragm, because I know I've said it but haven't really elaborated. So when we take a big breath in, our pelvic floor naturally lengthens and descends. So that's like relaxed state. And then when we breathe out, it recoils back up. When we talk about breath though, we want to get like a really good diaphragmatic breath. So it means like 360 expansion. So when you breathe in, you want to try and get a bit of a rise through the front of the ribs, the side of the ribs, and the back of the ribs. So when we're creating length, like I said, that's more on the inhale. And then when we talk about lifting the pelvic floor or contracting, that's on the exhale. So say we're picking bubs up off the floor, we're in a lunge position, you're going to contract that pelvic floor. So think like kind of Kim said, so either we're stopping the flow of wee, maybe drawing that up, or you're holding onto a fart, or maybe you're feeling like there's a tampon at the entrance of your vagina. You're holding onto that tampon and drawing it back up. So we're contracting the pelvic floor, and then as we're trying to bring bubs close to us, then as we stand up, we're breathing out with the contraction. So that will just help to protect the pelvic floor. Because if we hold our breath as we're coming up, and we've got that pressure of bubs as well, we're just putting a lot more pressure down through the pelvic floor as well. Yeah, so that just helps to kind of protect it the most. So the same like if we're lifting the pram to the car, engage through that pelvic floor. So we've got that lift, we've got that deep core on. We're breathing out as we put the pram in the car, and that will also protect the pelvic floor.
So interesting. I can't tell you the amount of times I've put the pram in the car, like with my back fully hunched over, like, and I'm just like, this is so wrong. Like,
you do what you can.
Yeah, but now that you said that, I'm like, oh God, like there's a way. Do better. Like, come on. Like, or even now, like lifting it out, I'm like, hurt myself. I'm like, come on, like better.
Yeah, think close to your body.
Yeah, that totally makes sense. But even as you're doing it, you're just like, this is stupid. But yeah.
And it's all I got in this moment.
Exactly.
Yeah, like I'm going to regret this.
Get it out.
Literally. Because the kids are screaming in there and you're just like, you have no time. But it is important like to look after yourselves. And like, as you would know, a lot of mums don't have the opportunity to do that. And I will say as well, like when I've come to see you guys, I bring my kids. And that is a safe space for them to come. So also if you can't come and see you guys, find someone who will let children come, because it's so important. And
they're so much fun. I kind of I'm like, oh, more entertainment.
Yeah, you said that when you're just like, I've had the best appointment. I'm like, oh, okay, well, this is
also,
like, I'm
Zara,
glad.
your girls are so good.
Zara was like to me, oh, Josh's kids are so fun.
I know. Honestly, I'm like, bring the babies, bring the kids. Like it actually makes it more fun.
And it's practical. Let's be real. Like you can't find a babysitter to go have an appointment. So it just makes sense.
That's right. But I do remember when I bought my first to see you, I think we were 6 months in, and she screamed the entire time. And I was like,
work around it.
Yeah, and you were so good. But I was like, oh my God, that was just not great for anybody. But yeah, they
rocking the pram, trying to treat at the same time.
One hand on Georgia, one hand on the pram.
But like it's a lovely opportunity to come, and also for like the kids to see this is
for women's health. Like how great that you're actually exposing them to that too, right? Like that's pretty cool.
Yeah, you kind of have to, don't you? Because as a mum of 2 girls, I'm like, this is important. So when we were with the internal, like you left the room and I'm taking my pants off, Kim, and my eldest, who's nearly 5, is like, what are you doing, Mum? Like, what is happening? And I'm like, well.
Did you have to unpack?
I just briefly explained, like, this is what's happening. But I will say, like, as I said to you before, having the internal exam was totally fine. Like, I think if that's also something you're worried about, like, it's actually really not bad. If you've had an old school pap smear, this is way less bad. bad than that, right?
Definitely.
And also, if you have been checked during birth, like when they check your cervix
Yeah.
to see how far along you are, that is horrendous. It's nothing like this.
Yeah.
This is like so chill,
Yeah.
really.
And also, like, you know, say if people aren't actually even comfortable with internals, like there's a lot of information we can get externally.
Yeah.
You know, maybe not the same detail, but yeah, there's still option for like external too. But yeah, exactly. It's very much guided by the individual. If they're not feeling comfortable, we just don't do it. And that's okay.
Yeah,
you know?
that's exactly. That's
Yeah.
good to know as well. But I will say with the internal examination and then how, you know, finding out that muscles that were relating to my hip pain, that became
And the back.
the back became so
Yeah.
obvious to me where I was like, oh, that makes sense.
You're
I
like,
can feel.
this is my pain. I'm like, yeah, how
Yeah.
fascinating is that, the correlation?
Yeah, I can feel that makes sense. So now I sit on my spiky ball and I'm like, ugh.
I'm impressed you did the spiky ball. Honestly, I can't do the spiky ball. It's
not a lot of
tennis ball.
Yeah, because I don't have one, but I need to get one. But I've stolen the one that my husband used for his feet, which is also probably gross too. But I'm sitting on it and I'm just, yeah. And I'm like sitting on it, I'm just like, this is horrendous. But I have no doubt it's helping. Like,
That's great.
I have no doubt. Yeah.
So
and
good.
Yeah. And already feeling better, like the scar massage, like all these. And the
So
rehab that
awesome.
you gave me was also like really achievable. The first
Okay, good.
few
Yeah.
steps. So people, you know, should know that too, that it's not like going and having to do 50,000 Kegels.
Yes.
Because like,
And sometimes that can make it worse. Like that might not
Yeah.
be the best thing for you too.
I was going to ask you, like, because also, you know, Kegels is a thing where people think, oh, I should just do if I'm having these symptoms, I should just smash out these exercises.
Yeah.
But it's, you know, A, how do you really know that you're doing it properly? And B, like, is that the right thing to be doing? Like, I'm sure you've had people come to see you that are like smashing, probably doing too many, maybe.
Definitely. Yeah. And especially I think like, say even postpartum, it's like part of most people's kind of post going home education is literally like, do the Kegels. Like that's probably like all they're kind of told, right?
Yeah.
Or
Yeah.
even if people do have any urinary symptoms or things, they're just like, oh, that means I need to do more Kegels.
Yeah.
You know? Whereas exactly, it may actually not be the right thing for you. I still love like being able to down the track build up strength, of course, and then have good length. But a starting point, if we're just smashing Kegels and we actually have that overactive pelvic floor, so more tension through the muscle in the pelvic floor, we're actually just going to heighten the symptoms that we already have.
Yeah.
Yeah.
Yeah. And something else that we discussed as well was like the position of your baby when you're pregnant, which kind of like really, it makes sense when you think about it, but you know, like putting that constant pressure on the pelvic floor of like where their head are or where their feet are, it's like something that you know, you just go about your day when you're pregnant. You don't really like, you don't really think about that. Yeah. It's more like the birth. Like if you have a vaginal birth, you're like, oh, that's when my pelvic floor is affected, but not really. Like it could just be that.
For that 9 month, well, you know, probably from say like 6-7 months.
Yeah.
Yeah, exactly. As bubs, and especially if we have a big bub, it's like, well, and like they sit low, then that's so much more, the pelvic floor is just having to work overtime because there's so much more pressure down through that structure.
Yeah. Yeah. Well, my second daughter was born at 5 kilos.
Yeah, see, that's insane.
Insane.
Wow, I didn't know that actually.
Yeah. She's like, she was enormous. When she came out, the doctors literally said like, congratulations, you have a toddler. Like but
also impressive. You're like, yeah, I carried that for 9 months.
I know, but I could barely walk at the
by
end of it, I got to tell you. But so because she was like transverse and her feet were on my pelvic floor,
Down.
you know, feet were down, but then I had a Caesar, and so it was like, oh, because you didn't have a vaginal birth, there wasn't like a conversation. It was like, oh, you had a heavy baby. If you have some symptoms of like, you know, the obvious symptoms, go and see someone. But yeah, like I said, not everybody can know everything, but it wasn't a discussion of, hey, look, you are probably going to have an overactive pelvic floor. Not that someone can diagnose you or whatever, but you know, it's like
even like a pre-warning or look out for these. Yeah.
A conversation or even like, hey, having an overactive pelvic floor is the thing. Because people don't know that either. So
exactly. They often just affiliate, especially like postpartum, they affiliate more weakness. Like I think that's what we talk about a lot is like symptoms of prolapse, perhaps symptoms of stress urinary incontinence. So that's like leakage with coughing, sneezing, jumping. And a lot of that time that we do need to build up strength with those factors. But yeah, exactly. They don't often talk about the things like the overactive. So maybe you're getting pain around the pelvis or the hip or the low back, or when you sit, it actually hurts. Or you are getting urinary symptoms, but they're more associated with like a bit more overactivity than it being weakness side.
Yeah, it's interesting. And I think a lot of people don't know that with an overactive pelvic floor, you can still get symptoms of leakage, incontinence as well. It's just
I didn't know that. Oh, okay, cool, right.
Because it's more of a, like if you imagine your pelvic floor is like a bicep and it's really tense and you're walking around doing a bicep curl all day, and then I ask you to do a bicep and you can't do it, it's the same thing with the pelvic floor. If you're walking around with this pelvic floor tension the whole day and then it needs to like contract more to hold in urine, it can't do it because it's already at its absolute fatigue point. So then you still get those symptoms of leakage and everything like that.
There you go.
And I'll get that a lot in my running population. People will be like running and then they get like leakage or urgency, and then it's more of an overactivity tension issue rather than a weakness thing.
Oh, there you go. And that's probably, again, why people should see a professional, because they think, oh, I'll do Kegels. And then,
Because if those people do Kegels, it's definitely going to get worse.
Yeah.
Oh, and we create, like when we talk about that nervous system component, then we're just creating sensitivity in an area. When there's like overactivity and dysfunction, it means there's more messages there. So often then what happens is people might also get bladder symptoms of the thing of needing to wee all the time too. And so then they're going all the time, or maybe they actually have symptoms of constipation as well. And so then they're straining. So they're constantly putting load and pressure through a pelvic floor that is like, we're holding on for dear life.
Yeah. Wow. I just I think like no matter what's happening, it's so complicated. Like in terms of all this stuff, it's probably like information overload. But if anything, it's like go and see a pelvic floor practitioner. I think like even if you are not quite sure, you don't really know, just go and
and sometimes it's literally nice just being like, what's my pelvic floor like?
Yeah.
You know, and then you're just like, okay, cool. I actually have a good lift. I have a good let go. Here's some other tools. Maybe breathing's not amazing, so we just work with that. And then amazing, you're good to go. Like, you know, it doesn't have to just be that there is necessarily something wrong. It can just happen. You can just build awareness in the area and help you for the future.
Sure. Yeah. And especially if you're going to planning on having kids, then like doing it before you actually get pregnant. So then if there's something you need to work on before all these other factors come into play, it's a good chance to be like, okay, well, I'm going to do 6 months of pelvic floor rehab or exercises or down training or whatever you need to do. So then when you do get pregnant, you're in a really good spot. So there's less work to do.
That's a very amazing point. And that is amazing, because I don't think a lot of people would think to do that. Like, right. And so, like you said, postpartum, you've kind of already addressed those issues, and then you just have to, well, depending on, you know, what happens during birth and all that kind of stuff. Yeah. Yeah. Genius. That's why you're here, Kim. That's why they pay you the big bucks. Yeah, interesting. And also, I guess, you know, if you're like have a baby and then just start running and you've got no idea what's going on, then like look at us.
The things you learn. So much to know.
Things you learn when the professionals come in and teach you all about this. But
we'll confuse you more, maybe.
No, I think like you said, just go, and if you're not sure, like at least you tick that box. And it should be a part of like every mum's self-care kind of thing, where it's like, because like even though you can't see it internally, there's no doubt that we're all stressed. Like even women in general, there's no doubt that we're all stressed, and therefore like our pelvic floor could be paying the price. And if not, like you said, at least you know, and you've sorted it. Yeah.
And you understand tools. So then exactly postpartum, if you go have a bubs, you're like, oh, I remember these tools. I'm going to implement these tools.
Yeah. Oh, look at us. Learning.
Like preventative healthcare.
I know. Who would have thought? But ladies, thank you so much for joining me. This was like a really, really super interesting conversation. And I have no doubt women everywhere, well, if they listen, we'll be we'll rivet it. But we'll have to have you come in again and have like another conversation. This has been amazing.
Yeah,
and
this
so,
is
Thank you so much. Honestly, this is so good.
Oh,
Yeah,
God. I'm
It's
glad.
good to spread the knowledge.
And that's
test our brains. I'm like, oh, hang on. What do we know?
I don't think you need to test your brains because you're both incredibly knowledgeable. I will say, like, you know, and I'll do like a plug for the clinic because every time I've come to see any of the people working with you, for you, I walked out the other week, I had a sore back. I walked out, my back was fixed. I'm not saying that's for everybody. I'm just saying.
But that was your unique experience and it may not be uncommon.
Jump on Google reviews. But yeah, like honestly, going to somebody, an actual like practitioner, you know, and fair, like it's lovely going to get a massage or whatever that is lovely. But sometimes if you address your pain, actually all the time, if you actually address the root cause, you're kicking goals.
Definitely. And we'll always give you a little massage as well.
True, yeah.
You need to get your bang for your buck.
And some, nice relaxing alone time if you can manage it.
Yeah, I don't know about it relaxing sometimes.
Yeah, true. Good point, especially if you've got the kids. But thank you so much, ladies. I appreciate you so much. And total legends. Thank
Thank you
you
so much. Thank you.